China informed WHO, and WHO declared it a public health emergency. And Nigeria just started preparing. So all I know is that Nigeria CDC got the stakeholders ready, got at least 3 labs set to be able to identify. And at the airports, they have the screening points, and that's just it. Working with WHO also. As for the lab, they got panels sent to the labs to test them just to be sure that they are okay. I mean, that the labs are well and ready. And the labs have done that and given them the report. So we're just prepared should it come into the country. So Nigerian context as in, it's just like every other country is just expecting in case it gets there, because WHO keeps warning that surely this virus is still going to spread much faster. It's going to spread wider. And in Nigeria, for as long as people move around, people come in and they go out, I mean, the chances are there that the virus will come into the country. Unfortunately, it has come and we have detected it, just like the Ebola virus in 2014. And I'm hoping that we'll be able to keep it under check. The Italian is stable. There are about 54 people that are under isolation, being supervised. And if those ones are properly monitored and they are okay, then I think we are good to go. But the only thing, my only concern is that at the airports, we're supposed to have screening procedures there, that they screen people who are coming in. I do not know how this one slipped off them, because he came in on the 25th, and by 26th he was complaining, and 27th he was diagnosed positive. So, I mean, he must have slipped off them. I guess everybody should just be on their toes to ensure that we don't have any more.
So talking about how the virus is expected to manifest and the slip, quote unquote, that you touched on earlier, within 24 hours, within the time he came in, the 24 to 48 hours during which the virus was tested and confirmed, what were the signs that ought to have manifested in such a way that Nigeria could have avoided that slip, if it could have at all?
You see, this particular disease manifests in different ways. There are some individuals that are infected, they are positive, they have the virus, they don't have any symptoms. There are some others that are infected and they just have mild symptoms. They just feel well, just mild cough for fever, and they are good. But there are a few, just about 20%, that come down with severe infections. So it's the history is what they should really work with, the travel history. So when people are coming in, they should care to know whether they are coming from regions where this virus has been reported, where the disease has been reported. And if so, then they should necessarily quarantine them for 14 days. The incubation period is 1 to 14 days, meaning if an individual is infected, between 1 and 14 days, the symptoms could manifest. But remember, it's not everybody that shows the symptoms. So it's a travel history that they should work with.
Now, when you compare with other viral outbreaks that Nigeria has had to deal with in the past, Ebola 5 years ago, polio, and currently Lassa fever, to what extent, or what would you say are Nigeria's chances of beating this coronavirus?
Well, for me, I think we are improving by the day. We are improving by the day in terms of diagnosis. At the time Ebola came into the country, I guess it was only one lab that was prepared to do the diagnosis. And as at that time, when it was screened positive, they had to send the sample elsewhere for them to characterize. But here now, we have 3 labs that have been set up for this, and we have a research lab, like Nigerian Institute of Medical Research, for instance. We are also able to test, because we do have some collaborations with China. Before this outbreak, we're able to get the kits and we're able to test, even though NCDC has sent us some kits. And we're also sequencing as it is now. This we couldn't do before. So I think we're improving by the day. And I believe strongly that Nigeria also has structures from this FEL tip program. There's this epidemiology, training of epidemiologists, African epidemiologists, at the NCDC, they have this training that they are able to do contact tracing. And they were the ones that were involved in the Ebola outbreak. And they are also involved in this, trying to track the contacts so that they can monitor them such that it will not spread any further. I believe we will be able to handle it. The only thing is, at the airport, if they do not control those people who come in, screen and pick up people who have travel histories and quarantine them, then we will still have some others coming in that are infected. Yeah.
To what extent would you say that Nigeria, being in the tropical region, could impact its chances of containment of the coronavirus?
Well, Nigeria should be able to contain it. If we did contain Ebola, we should be able to contain this. The only thing is that this virus spreads much faster than Ebola. Ebola, one will only be infected when an individual gets in contact with someone who has symptoms, okay? But in this case, there are people who don't present with symptoms and yet they are infected. So I believe that if everybody does what he's supposed to do, we should be able to contain it. And I will still emphasize again, at the airports.
There are conversations that the virus doesn't exactly do well or survive for long in tropical regions, in hot countries of the world. Is that true?
Yeah, the virus is not, I would say it's fragile, meaning that heat can inactivate it, alcohol can activate it, even our common bleach can inactivate it. The disinfectants we use can inactivate this virus. So I believe strongly that it will not be able to survive on surfaces for so long. Okay, ordinarily they say it survives between a few hours, about 12 hours, to several days, up to 5 days. But with the heat we have in Nigeria, I believe it shouldn't support the survival of the virus for too long.